Hello, my name is Hording. I'm a consultant psychiatrist, and I would like to talk about different disorders. Today it will be hoarding disorder, which only recently has been included in diagnostic systems such as DSM-5. I'd like to tell you a story at the end about patients I met, and especially about patients I met in South Scotland on a locum, and it was a short but interesting encounter. So the hoarding disorder is a difficulty discarding or throwing away possessions, and this is regardless of their value. You personally have heard about people collecting papers, journals, or any other thing. Usually it causes distress, but not only to the person who struggles to throw things away, but also to the environment, because very often the contact is not via physical health or mental health doctors, but via social services. There is a significant impairment in social, occupational and other functioning, and there sometimes is very poor insight, and sometimes people have excessive acquisitions, such as buying hundreds of DVDs from charity shops, sometimes if they don't even have a device to play these DVDs. This hoarding disorder, so this excessive hoarding of items of very little value, can be related to OCD, obsessive compulsive disorder. People have sometimes depression, can be autistic or having a psychosis. Some people have cognitive deficits, and sometimes it's related to the early stages of dementia. Many people have anxiety disorders and depression, and in total, hoarding disorder is described to be in a prevalence of 2 to 6% in US and Europe. In general, it's more male than females in the general population, and it's very common in older adults, age 55 or older. Sometimes happens in youngers, but sometimes it's not as bad because there's more flexibility in life. There's risk factors. Certainly indecisiveness is a problem. Sometimes stressful life events or some trauma. And some people say there might be some genetic causes in the background, but I'm not sure that, I have never heard that any of these genes have been found or even assessed. Sometimes in some children, this symptoms may start at 11 to 15. Usually, initially, it's not a big problem, but this hoarding can really be a problem for people in their mid-20s when they're not be able to leave their house or flat, or can't use their flat, or have to reduce social connection with others if they have no place to invite or see someone. The treatment is usually CBT, cognitive behavior therapy, relaxation, trying to help with decision making, and sometimes the pain and the suffering is so great that people would agree that social services would do a clean up. It's not very uncommon in mental health that we have to organize big house cleans for people who do some hoarding, but also who have schizophrenia or other diseases. There's lots of comorbidity, anxiety, depression, so you can try with an SSRI, but much of the treatment is supportive. coming back, so I've seen quite a few, and I remember a guy who came to me in his 80s in completely impeccable outfit, sparkling red jacket, and it was spring, so he was quite cheerful, friendly, and he was referred by the social services team member due to the fact that they couldn't engage with him. So I had a chat with him, and eventually the time went over and I gave him a lift home. And he was so friendly to invite me, and he hasn't allowed anybody coming in for years. And there was water standing in this in the floor in the cellar. He had collections of bottles of milk, possibly a couple of hundreds, nicely collected on the floor. He had a nice collection of egg cartons, which built up against the window and took the light. He had collections of old paintings and pictures from his parents. He collected more or less everything his parents have had. He was lying on a bed which was falling into pieces without any duvet or cover, and there had been some complaints from the neighbors, but never ever had anybody from council being able to come in. I was able to come in. I'm not sure whether this had led to anything. I had to leave later, and I'm very sad about that. But he engaged, at least for quite some time, with social services who tried to get the house into order. He very often said that the past is his life and he needs all these things to remember, and he more or less lived at his home in one room, beautiful home. He lived in his home in one room, went to the pub for a drink and his meals, and that was his life. He was very isolated, and I hope his life is getting better with the support he previously didn't accept, but hopefully will accept in the future. See what happens. Anyway, so that's about hoarding disorder. Can be a problem for the community, for the neighbors, and for the person who suffers most, because it's a pain having to live in situations where they can't get out and where they spend all their life thinking about what they should do with this can of milk, with this old CD, with this old pair of shoes, or else. Anyway, sad stories, but that's part of psychiatry. I wish you well, have a nice day, and if you want to hear more about these issues, please don't hesitate to subscribe to our channel. Thanks a lot. And